Well, a national blood emergency has been declared today by the American Red Cross. The organization, which supplies around 40% of all blood and blood products to U.S. hospitals, says it's seeing a sharp decline in donations and a surge in demand at the same time. In today's Health Minute, Mandy Gaither has a closer look at the severity of the shortage and the types of blood the organization says it desperately needs.
It happens every summer. Blood donations spiral downward while demand spikes. But this year, the hit on the blood supply has gone well beyond all expectations.
In the past several weeks, we've seen an increased need from hospitals of about 3,500 units of blood each week, beyond what we would typically expect.
In the month of June alone, the American Red Cross says their supply of the nation's blood has been depleted by nearly 25%. Summer is already seen as trauma season, when hospitals tend to see more serious injuries and medical emergencies. Add in people traveling, plus July 4th celebrations and popular sporting events. It's equaled an influx of people in certain areas and an unpredictable need for patience.
When we see that our inventories are starting to drop and that hospitals may be forced to make difficult decisions, that's really when we need to put a call to action to bring donors in to help replenish those stores.
While all blood types are needed, the Red Cross says the shortage is especially serious for O positive and B negative blood, as well as plasma from donors who have type AB blood.
Someone needs a blood transfusion every 2 seconds in the United States. And so there are patients out there whose lives depend on the generosity of their community members coming in to give the gift of life.
For Health Minute, I'm Mandy Gaither.
And anyone interested in donating blood can book an appointment through the Red Cross Blood Donor app, by visiting redcrossblood.org, or by calling 1-800-RED-CROSS.